A fetal echocardiogram is a non-invasive test to look at the baby's heart before the babies are born. A fetal echocardiogram generally is performed around 24 to 28 weeks gestation, although we can look at the baby's heart earlier. Typically, we would get the referral after the obstetrical team has done their initial ultrasound around 20 weeks. Generally, we would perform a fetal echocardiogram for certain conditions. If on the obstetric ultrasound there was a question of concern about the baby's heart, we may look at those things more in detail. There are certain maternal illnesses that might put the baby at higher risk of having a heart defect. Medications that moms may be on also can put the baby at higher risk. Sometimes if the baby has an irregular heartbeat or a fast heartbeat, that might be another reason we might look at the baby's heart. During the fetal echocardiogram, usually we would have the moms there and we use ultrasound similar to the obstetrical ultrasound testing. We look at all the chambers, all the valves, the blood vessels as they come out of the heart, the function of the heart, and then we usually use what we call color mapping, which is to look at the direction of blood flow with the heart. That helps us see how the blood flow travels through the valves. If there are any holes that are in the heart, we might see the blood flow across those holes. Usually with one fetal echocardiogram at that time, we can see enough of the structure and anatomy to evaluate if there's any significant heart disease. Sometimes we like to have the moms come back to relook at things as the baby gets a little bit further along gestation-wise. When we have patients that come through, particularly if there is an abnormality with the heart, it can be very challenging, and obviously for families, to hear the diagnosis and then understand what are the next steps. So if we do diagnose a heart condition for the baby, then the fortunate thing is we have our team all set up at Fetal Care. The way we try to do things is really from a whole team approach. We go over the cardiac diagnosis in detail. We talk about what are the potential expectations. Will the baby need intervention or surgery soon after birth, somewhere in infancy or later? We talk really in detail about what to expect after the baby's born and the whole delivery process, and if babies need to come over to our hospital, how does that process occur? We talk about how mom's going to be monitored in pregnancy. We don't want the families to worry about how often do I have to be seen, who do I have to tell what's going on. We spend time talking with the families to talk about the general timeline and even into adulthood what to expect for their child. We also coordinate counseling with our cardiac heart surgeons if the baby's going to need heart surgery at some point. We have you meet with our neonatology team who takes care of the babies right after they're born. And we have a variety of other services that really help to put the families at ease so that they have an idea of what to expect when the baby delivers and from there afterwards. I think really just putting those steps into place for the parents to have a little more insight as to how things will transition gives them a little more sense of control, and we try to relay our experience with these patients and the babies and how we'll do the best for them with their condition.